Dr. Jazla is a renowned public health and healthcare management consultant, author, and a TV presenter. With memberships in prestigious organizations like the Emirates Public Health Association and Global Network of Renewable Energy, her expertise spans diverse sectors. Dr. Jazla's contribution as a healthcare researcher and a faculty at Westford University College demonstrates her commitment to education and research. As the founder of Visionary Mindset Professional and Management Development Training, she combines her academic insights with practical experience. As a webinar panelist today, her unique perspective will enrich discussions on navigating modern challenges in public health administration and healthcare management. Without further ado, I'll pass on the mic to her. Over to you, ma'am. Thank you so much.
Thank you, Ankita. Thanks a lot for introducing me. Okay, so hello everyone. Today we're gonna go and explore the public health administration in the digital health to know further about public health and public health administration and what do we mean with digital age and how we can implement digital health or digital age in public health administration. Now, usually, when we are talking about public health, let me minimize this in order to make it, yeah. Once we are talking about public health, and there is some confusion. Some people they don't know what does public health mean. It's related to the you are responsible like the GP, like the general practitioner. No, public health it's the science and the art for preventing diseases, for prolonging life, and saving life of people, of population to live longer, and this needs well organized efforts from multidisciplinary, let's say. So public health, it's not like individual medicine that individuals visit doctors and the doctors provide the intervention or the prescription for this individual in order to get better. No, in public health we are providing prescriptions or interventions for the whole population. So what will happen in public health? In one click, in one single decision, or in one intervention, then you can save lives of millions at once. And this is the core concept of public health. Now, in order to do this, of course, I need administration. I need people who are taking responsibility. So then, if I want to define public health administration, it's of course it's required. It's a branch from public health, and in public health administration, we are before I say that we are ensuring that all the organizations are running. Their tasks successfully, but what they are doing. So when I say here, I want to stop at I talk about the pillars in public health, and that's why public health administrations actually it's essential. So when I say public health, it's it's related to health promotion, it's related to health protection, it's related to health prevention. So let's have a look. When I say health promotion, what does health promotion mean? Health promotion in general, it's related to determinants of health. Okay, so we want to work on the determinants of health, all the determinants that promote people's health in order to put them in the environment, in the lifestyle, or promote the lifestyle that will keep them healthy and away from especially chronic diseases. Okay, when I say protection or health protection, it means that we want to put people away from the all kind of pathogens. So any external factor that can affect people's health, like pathogens, like chemicals, like any hazards that are associated with people's health. Okay, when I say now preventive or health prevention, it's about how to prevent in the first place people's health. Like for instance, the most vital and popular example is doing the vaccination. So public health is about everything. It's about making interventions related to the three levels of healthcare. whether it's primary healthcare, which is related to the prevention, or secondary healthcare, which is related to therapeutic, or more in-depth, which is tertiary healthcare, which is more in-depth care, which is a part of it. It's also rehabilitation. So public health is the umbrella of everything, umbrella of making sure that all the health services are delivered at the right time to the population when they need it. Okay, so also public health, it's related to empowering people to take decisions over their lives, as we said, as part of health promotion, and providing them with education, and also provide medical education and the training to healthcare providers to make sure that they have the capabilities to provide healthcare services to the population. So the purpose of public health administration at the end of the day is to provide health services to people efficiently. Now, I want to stop at the word efficiently. What does efficiently mean? Efficiently or efficiency, it means that you are optimizing use of your resources without any wastage. You are using your resources when they need it, or when you people need it, without underuse, without overuse, without misuse. This is the efficiency. And this is very important also, because otherwise we will waste our resources, and once we need it in order to provide the proper interventions, then we won't find these resources. So then when I say public health administration, it means that I need administrators. And if I want, sometimes there is confusion between the word administrators and administrative. Actually, there is a big difference between this. When I say administrators, it means anyone in charge. Managers are administrators, executives are administrators, coordinators are administrators, head of departments, head of units, all those, anyone in charge is called administrators. Okay, so the administrators are responsible, in charge of what? First of all, they need to manage human resources. When I say human resources management, it's about, this is our resources. We have physical resources and we have human resources. We need to ensure that we have the capacity and the capabilities for the human resources. The capacity in order to cover or to maintain the coverage of providing services for people or for population. And when I say capabilities, it means they are equipped with the skills and the knowledge that are needed to be proficient enough to provide the services. What else? They are also, administrators are responsible to create the budget, to secure the grants, to fundraise the healthcare organizations, because this is our physical resources that we do need it in order to provide our services. And the most important thing, that we cannot manage what we cannot measure. We need to measure. And measurements, it's very important. Why we do measure? We do measure because, and when I say measurements in management, in administration, measurements, it's about monitoring and evaluation. Why I'm monitoring? Because I want to make sure that everything is going on as a planet. Why I'm evaluating? Because I want to see that I have achieved the results, that the desired results, or the results, or the targets, or the standards. I mean the standards, the target that I put in the first place. And then I will improve the performance. If any lack of performance, or if any distance from the standards or the targets I put, and then I can, of course, do the corrections and adjust my strategies in order to have higher performance. Okay. Also, they are responsible for good relationship with the stakeholders. And in healthcare, the main stakeholders that are influencing our healthcare organizations the government. Okay, so we have many stakeholders in healthcare. We have the government, we have the healthcare providers, we have the healthcare administrators, we have the patient themselves, we have the media, we have the NGOs, we have the insurance companies, and so on. So the administrators are the one who are responsible to maintain a relationship with those stakeholders who are impacting the facilities and impacted by. And also they are responsible for drafting the reports about the trends. Now I want to stop here and talk about the trends in public health. If we want to review together the trends in public health from the past till or so far, what kind of trends we have witnessed in public health? We have witnessed first the preventive health, wellness programs, how to promote healthy lifestyle, how to support the screening, the vaccination. We have a trend of having zoonotic diseases, the diseases that transmit from animals to people. We also, all those trends also are addressed by World Health Organization. Each year we have the theme of World Health Organization. We have health equity, which is related to the fairness in providing our services, fairness that we provide people with what they need when they need it. And equity, it's different from equality, which is the sameness. And in public health, in healthcare, we usually provide equity, not equality, because equality, sameness, we cannot provide it. And another trend is social determinants of health. We'll talk about this, and this is very interesting, and we will project it on the digital health. When we talk about social determinants of health, it's all the environmental, the economic, the social factors that affect our health, and we'll see this later. When we talk about trends, also it's related to mental health support, how to integrate mental health into our primary healthcare programs. And also we have recently the trends of climate change and the health impact, associated impact of climate change, how it affects our health, what are the direct effects of climate change, which is related to the weather extremes, the natural disasters, and which is the indirect or the indirect effect impact of climate change when we have pollution, when it will affect the air or the soil, or in general, it will affect indirectly our health, like having, for instance, affect ecosystem and having vector-borne diseases. The pandemic, we recently witnessed in 2020 the COVID-19 pandemic, the re-emerging diseases, the diseases that we thought it has been eradicated a long time ago, now it's coming back. We have also which needs from us preparedness and strengthening of our healthcare system. And recently, the pandemic really revealed that some healthcare system were fragile. We need to relook at this again. Now, the recent trends in healthcare now is digital health, data analytics, and we will allocate time to talk about it in this presentation. Now, the public health administrators then have some commonality in the tasks that are performed by administrators in another fields. So they are responsible, as I said, about with measuring, and measuring is about monitoring and evaluation. They are involved in the supervision of the employees. They are involved in preparing the programs that will support people's health. They are the one responsible for fostering the well-being for large section of population. Okay, because in public health, as I said, in one click, in one intervention, in one decision making, we are saving millions of life. And all the educational programs are, of course, prepared by them. I want to share with you this this survey, which is related to the percentage of time spent by the administrators or managers. How managers are spending their time. and we will give this in percentage, and we will see what things we have to think about it in order to maximize their potential for more effective, let's say, task. Now, this study or this surveillance revealed that the managers spend 7% of their time in developing people and engaging with stakeholders, 10% in strategy and innovation, 30% in solving problems and collaborating, and 54% in administrative coordination and control. So how we can maximize this section for strategy and innovation, and how we will minimize this 54%. Another survey showed that, okay, what are the essential managerial skills that we need to have in the next half decade? As you can see, at the top, we need the skills of digital and technology, having command and skills in digital and technology. This is in general, in all sectors, not only health. We need also to have skills in the creative thinking, creativity. And I will tell you now the difference between creativity and innovations. They need to have also skills in data analysis, interpretation, in strategy developments, in planning and administration. However, all this digital technology, creative thinking, the data analysis, innovation, strategies, quality management, the performance management, reporting, all this can be done with machines aid, let's say. But we need also to focus on skills which is related to interpersonal skills, people skills that managers should also have, like social networking, people development and coaching, collaboration. But at the end of the day, as you can see, at the top priority is having commands and experience and skills in digital and technology. Okay. So what is innovation? Sometimes there is a confusion between the word creativity and innovation. To be, what is the difference between being creative and being innovative? Actually, creativity, it's about having new ideas. And innovation, it's about implementing these ideas. Now, we want also to differentiate. Is there any difference between innovation and invention? Yes. Invention, you are just the inventions that we have witnessed in the humanity, like the invention of plane, the inventions of so many things around us. It's not related only to commercialization. Innovation, it's not only related to commercialization, it's more related to adding value, to making to adding value and to make it more cost effective, more efficient, more effective. Okay, now what are the characteristics now of being innovative, or the characteristics of innovation? First of all, it should be culturally appropriate. When I say appropriateness, it's related to consistency with ethical principles, consistency with cultural principles, consistency with the preferences, with the needs. And in innovation, we do need them. Now, innovation should be sustainable. And I want to stop at the word sustainability and tell you that sustainability, what does sustainability means, and how innovation should be sustainable, which is as a one characteristics of innovation. Sustainability, it's how we can meet the needs of today, of the present, without compromising the needs of the future generation, okay, in order to meet their needs, their own needs. So sustainability as well, it's the quality of being able to continue over time. And in innovation, we should take this into consideration. Innovation Yes. Who raised his hand? I found. Yes. Any? Yeah. I found raising hands. Am I
Uh,
audible? Yeah.
yes, doctor. We'll be taking the Q&A post the lecture session, so you don't have to worry about it. I'll take care of it.
Okay. Okay. No problem. No problem. Okay. So innovation also is related to collaboration. We need to have collaboration. We cannot, it's not one man show. It's related to widen accessibility. And in healthcare, when we talk about accessibility to our healthcare services, it's not only reachability, that I reach the healthcare facility. No, accessibility, it's the start from the minute that the patient leaves his home till the minute he meets his healthcare provider face to face. And innovation will support this, and we'll see this in many digital solutions. It's related to the work across boundaries, how we can reach many people, how we can have the cost. Innovation is about cost effectiveness. And what is the cost effectiveness? Cost effectiveness means that if you want to attain a specific outcomes, and you have different interventions for that, you will use the less costly intervention that lead you to the same outcomes. And this is what's called cost effectiveness in general and in healthcare in particular. So involves local population. It's innovation about involvement, innovations about affecting change, doing a change. And when I say change, change it's the improvement and development. And without change, we cannot survive. Change is very important for the development, for sustainability. Without change, we cannot survive, and this is a must now. That's why we have a domain which is change management, how to manage the change. Innovation is about solving problems, make it easier, make life easier for population, and it should be evidence based. Okay, evidence based, that we have the evidence that it will make really the difference in efficiency and effectiveness. Now let me go to digital health and see what does digital health mean. Now when I say about digital health, from now till the end of the session, I want you to focus on digital health on three pillars of that. The first pillar is digital information. The second pillar is digital communication. And the third pillar is digital technology. And we will have different digital health applications, and we will slot each of them under these pillars. Again, digital information, digital communication, and digital technology. Let me start with health information, okay, in which it's come under digital information. So what is that? Electronic medical records, digitized records that we are using for diagnosis, for treatments, or so on. The knowledge generation, we have something called epigenetics. What is epigenetics? Epigenetics, it's one word, consists of two words. It's epidemiology, but in genetics. What that mean? It means the study of the changes of genes in particular population. Okay, how the genes, the genetics are changed due to some environmental changes, risk changes on lifestyles, and so on. And this will be also as a part of digital information. Now, from where we can get this epigenetics and epidemiological modeling? From using AI and ML, artificial intelligence and machine learning. And we will see later that we have difference between artificial intelligence and machine learning. Which one is included in the other? Machine learning is a subset of artificial intelligence. Why? Artificial intelligence, actually, it's about how we incorporate human intelligence into machines. But machine learning, it's about using statistical methods or using algorithms in order to make the machine self-learning by feeding them with data. Now, that's why we find that artificial intelligence focus on learning and thinking, but machine learning focus only on learning, but there is no using of the thinking or solving problems, or let's say focusing on the success. They are focusing only on the decision support, on the results, on the accuracy in results using algorithms. And I will show you later on also more differences between artificial intelligence and machine learning, but ultimately those are the knowledge generation, the information generation that will make a huge difference in our digital health. Now we have also knowledge integration. Using AI and machine learning with support in the precision aids, and we'll talk about precision public health later on, and predictive analysis. So what is predictive analysis use? Predictive analysis use is using our current information or data in order to predict the future trends, the future patterns of the diseases, of the outbreaks, of the pandemic. And also artificial intelligence and machine learning will support in that. Now, I will move to the second pillar of digital health, which is digital technologies. Digital technologies, like we will see wide range of digital devices, accessories, devices, machines that will support us in the assessment, in the monitoring, in the tailoring, and it's a part of the digital device. Now, let me move to the digital communication, telemedicine. Telemedicine and telehealth. Telemedicine and telehealth are the main examples of the digital communication. And telemedicine actually is different from telehealth. Telehealth is everything that you are providing the clinical and non-clinical services for patients and healthcare providers, educational part. So telehealth take the educational part. Telemedicine is more about clinical. So we are using telemedicine for diagnosis and treatments, whereas telehealth is take more a broad educational aspect. Now, diagnostics also, which is a part of the health information, how we have the remote sites maybe, which is also digital communication. We can diagnose remotely. We can use the analytics in order to know the trends. Imaging, also it's a part of digital technologies. Implantable devices, about it's a part of the digital technologies. Now, at the end of the day, in the digital public health, how we are talking about digital public health from the public health perspective. When I say public health, as I said in the very beginning, that it's related to population's health as a whole. So when I talk about population health, it means I need data. Without data, I cannot approach and reach people's or population trends, patterns, models in order to customize the intervention that fits them. So it's data driving decision making. I cannot make any decision on behalf of population unless I have data. But I need to have privacy, security. It should be confidential, confidentiality. All this is important. Not only having data that it can be stolen and used in a bad way. Okay. When I say also digital public health, key principles, another principles is collaboration. It's collaboration. Public health and healthy public policies, it's collaboration with many sectors and many stakeholders, as I said. It's about interoperability and data sharing in order between those stakeholders, of course, this network. It's about equity, fairness, provide people with what they need. So we need to use digital public health, but taking into consideration these key principles. Let me now move to a very interesting topics and projected on our life nowadays. Social determinants of health. What does social determinants of health mean and how we can just project it on our life? As I said, social determinants of health, it's all the environmental and educational and social and economical factors that affect our health. And we can slot under social determinants of health many aspects, which is related to our physical environment, social environments with all its pillars. Let's now go to the one by one social determinants of health, that the social aspects, as I said, that affect our health. Let's start with work. What is the change or the work in the digital age? Now we have work from home. We have so many digital technologies that make the work easier, efficient, effective. Whether you are working on site and there is some digital devices that will support you, and whether you are now working with home with the same efficiency and effectiveness, and this is will make the work easier, and this is how we reflect work on the digital age. Let me go to the surroundings. Surrounding the environment, the physical environment. What do we have now? What about surrounding? How we read surroundings in the digital age? Surroundings. I will give you example, which I'm proud to be a part of this network, global network, which is World Renewable Energy. Renewable energy technologies support us a lot. The solar panels, the energy generated by water, by winds, all this are the digital surroundings that support our surroundings and make our life easier. Let's say another thing, to connect with others regardless to their locations. This is also a part of the digital age in the surroundings. GPS, using GPS, how we navigate, how we can go to the locations we want. Smart cities. Now we have smart cities using the technologies, the information of technology devices, and for the infrastructure. All this reflect the surroundings in the digital age. What about the food we eat? What's the relationship between the food we eat and the digital age? We have now something called digital agriculture technologies that make food more or increase productivity in the food or in the agriculture, that will make the food more available, that make the food more accessible, and that will support in the distribution of our food. And even though now in some smart homes we have the fridge connected with our mobile phone and with the stores, and they can, whenever we have something shortage in some materials and some items, it can directly, and we will have this to be for everyone, not only in smart houses later on. Now the housing. What is the housing in the digital health? Now in the digital age, sorry. Now we can see that people can buy, can sell, can rent while they are at home. We have now digital platforms, online real estate platforms that you can browse, and even though using the VR, and you can navigate your house even though without going physically to the house. You can buy, as I said, you can sell, you can rent, having e-signatures, e-documents. All this make your housing in the digital age easier. What about the communication, the platforms? Okay, how many? The Facebook, the Twitter, the Instagram, TikTok, all this, LinkedIn, all this make people connected. We are all now in small village in the world. The transportation now in one click you can pick your tickets, whether it's for train, whether it's for plane. You can use Uber for your internal transportation. We have now self-driving cars. We have the bike sharing programs. We have intelligent traffic managements. All this also represent the digital age in transportation. Now, in education now, what are we doing now? We have now remote education, online education, that people can, in one click, be exposed to many lectures, to many information, and get the skills they need, also using this digital communication platforms. And lastly, what about the money and resources? How money and resources have become in the digital age? What about online banking? What about the digital currencies, cryptocurrencies, and Bitcoin? What about Apple Pay? How we can, in one click, send money, receive money by using, as I said, the online banking. Not only this, now people can generate income easily while they are at home using all these technologies. So, what is the model for optimal implementation of digital health innovation? So, we talk about public health, we talk about digital health, we talk about innovation, but now we want to optimize use of digital health innovation. Actually, we have model for that. This model start with data, as I said, the data. We need to have mining of data, data management. So we need to process large volume of data with security manner, stored manner, that will securely store our data. And then we need to have this digital biomarkers. What are the physiological, the behavior data that we can derive or predict the outcomes, and then we can use the AI, artificial intelligence, and machine learning algorithms in order to see the trends and the models as prediction. And then we have the clinical integration, in which we have this efficiency in the workflow in order to enhance the clinical decision making. This is how we optimize the digital health innovation. Now, let me also share with you this interesting figures. The patient's choices, which is how patients look at technologies. Let's see some figures. Actually, patients are patients with technologies, or they don't agree with technology? No. Patients want their providers to use technologies, but use technologies for what? To make accessibility better, to make communication better, and to make also the patients more involved. And again, when I said accessibility, accessibility is not reachability. It's not that I'm able to reach the healthcare facility. No, accessibility means also that the meeting our healthcare provider face to face. I will tell you a study done by United States about the opportunity cost of meeting a healthcare provider, and measured by minutes, not by minutes. They find out that the opportunity cost of meeting a healthcare provider in terms of minutes was 100 minutes. And those 100 minutes were distributed as the following: 45 minutes, let's say, on roads, and 45 minutes between admission and accessibility and registration in the facility and waiting time, and only 10 minutes meeting healthcare provider face to face. So just look at this figure and see how really we can maximize the opportunity and reduce the opportunity cost and make the accessibility higher using this communication and telecommunication. So another figure is 76% of patients say that technology has the potential to improve their health. Of course, because they are more communicated and more informed and they can access easily, okay, and more efficiently. So it will improve communication, accessibility, and involvement. And another figures represent that 60% and 62% of patients want to communicate with providers by email remotely. 64% of patients want to schedule their appointment online, and 9 out of 10 of patients want shared decisions making with their providers. So they want also to be involved. This is related to involvement. Now, what are the other figures related to communication? 69% of patients feel that it's really important for providers to follow up. So communication, it's about following up. It's about informing the patients. And for the accessibility, 61% of the patients say that digital services are important when choosing a physician. They want to choose their physicians in according to their preferences, there's the specialization, maybe the cultural pace, and two-thirds or 2 out of 3 of patients, they want to switch providers for access to medical records online. So they want also to have accessibility of their medical records online. And all this will reflect the digital age in the patient's choice. Data analytics and public administration. Now, when I have data and analyze this data, how this will support public health administration. Number one, it will, of course, inform the decision making with evidence base. See, this is the analysis, this is the data, this is the analysis of data, this is the results. So you have to make this decision, and this is the evidence. Okay, so we have the surveillance, we have the monitoring, we can monitor, we can make more health promotion, and we can prevent diseases because why? We are doing the right decisions that promote our health. I know the trends. So when I know the trends and the patterns of the diseases, then and the behaviors of people, then I know what should I do for promoting their health and prevention of their diseases. When I have this data and analyze it, I can know, okay, I want to do these programs, what kind of resources I do need. So I will be able for resource allocation and planning. I will also work on the quality improvements and performance monitoring. And the most important thing, that data will support you in the risk assessment and prediction of all the risk that you can do proactive strategies and reactive strategies. So this is what we call the predictive modeling. The most important thing in data analytics is predictive modeling, that we can use our data for forecasting the trends and the risks, and the epidemiological surveillance for monitoring and analyzing the patterns, and the performance evaluation in order to see that I reach the effectiveness. And always, again, I would like to say that effectiveness and efficiency are very important, but they are different. Efficiency is related to the process in which you are optimizing using of your resources without any wastage. And effectiveness, it's related to the results. It's related to the outcomes. It's not only about providing interventions and programs and wasting our resources and allocation of resources. It's about making sure that these interventions and these programs really achieve the desired outcomes that we want to see, or the effectiveness. So Predictive analysis, surveillance, and monitoring are very important in decision making. And this data analysis will support again let's recap on that, will support the decision making in attaining the outcomes, support them in the resource allocation, optimizing of their resources, in monitoring, evaluation, in evidence-based decision making, and what are the trends and the patterns. And ultimately, once I have a right decision making, it means I will have the power of data that supports the decision making of public health administration, in which we can address public health challenges more effectively and improve health outcomes of people. Now, this can be done easily without any challenges? Actually, no. Of course, we have challenges for that, and anything we have um, uh, we have challenges in public health administration. What are the challenges for that? The most important challenges and the most prominent challenges usually we face is the resource constraints. If you have limited resources, limited funds for your infrastructure to be able to provide the public health administration, this will be a many challenges that will be obstacle for processing this. If you are using the manual process, the paper-based documentation, this also will harden because we in one click using the digital age, digital devices, we can just process this data, predict the outcomes or the patterns, and then we will have quicker decision making and quicker interventions. Now, what else? So again, when I talk about digital transformation in public health, I emphasize on the digital communication, the digital information, and the digital technology. Digital communication, telehealth, and telemedicine. Digital information is how you have this electronic health records, you have genomic data, you have this spatial data, you have all this the data, the information that will support the precision or processing and analysis, and of course wearable devices, and I will give you example of that. Now, okay, so what's next? Once we have digital public health administration, what are the benefits of this? Of course, as I said in the first place, it will improve the access of care. Why? Because it will make it easier for your patients to use these digital devices, to use this online appointment, and to access and to use the telemedicine, telehealth, and to make accessibility better and more convenient. It will also be more efficient and cost saving. Of course, once we have technologies, once we have machines that give me the results in one click with less efforts, this will save our time and time is cost. So this will be more efficient. Also, of course, it will make the interventions easier. Okay, we are talking about data. Okay, so we need big data. From where this big data? From where we get our data in healthcare? We get it from governmental agencies, we get it from wearable devices, from search engine data, from smartphone, research studies. We get it from patient portals, from the insurance records, from the public records. So you see, we have wide range of generic database in which we have already generic database like MySQL and SQL service, which is wide range of relational database that are serving many kind of industry. Now, again, we have data, we have stored data related to our patients, so we do need to save this data, to secure this data. So that's why we need this security, this cyber security, the protection of our organization, the protection of our patients, the protections of our employees from all the threats. So How we can have this protection? We need to have regulations, we need to have compliance, and we need to have mitigation strategies. Okay, you will just wonder what are the threat mitigation strategies that will we have to follow in order to mitigate the threat of the cyber cyber security. Of course, we have different strategies like risk assessment, risk management. You need to predict the risk to have your proactive strategies and reactive strategies. We have the accessibility control, authentications, and we have the data encryptions. We have the security awareness training for your patients and for your staff. You have to have these regulations and make sure that there is compliance for that. Now, always we conclude with the future trends. What are the future trends and innovations in healthcare, in public health? In public health, the future trends and innovations are related to AI, artificial intelligence in public health, how we are using AI and machine learning in order to make as we said, to make it easier for us to process our data, how to use precision public health. And when I say precision public health, precision public health, it's like let's project it on the precise or precision in medicine. What is precision in medicine? You are prescribing or providing the intervention to the right person at the right time. This is in precision medicine, but in precision public health, you are providing the right intervention to the right population at the right time. And this is the most, of course, effective things we need to think about it as a future trend and innovation. Okay, how to tailor the interventions for the population. And we have also blockchain in healthcare records. Now, as I told you earlier, that there is a difference between AI. Sometimes we have confusion between artificial intelligence and machine learning. So which one has broad scope? Actually, it's artificial intelligence. Why? Because as I said earlier, artificial intelligence is about incorporating human intelligence into machines. But machine learning, no, it's only about how to use statistical methods, algorithms, in order to make self-learning of the machines by feeding them with data. So again, artificial intelligence focus on solving problems, doing tasks, handling tasks, decide, think. But machine learning only about using statistical approach in order to inform the decision and make it more accurate. So they don't care about the success. They do care more about the accuracy, whereas the artificial intelligence care more about the success. And the most important thing I want to make it as a difference that AI can deal with structured, semi-structured, and non-structured data. But machine learning can deal only with the structured and semi-structured data. So you have to feed them with information. So this will use artificial intelligence, will use the logic and decision trees, and this will use only statistical models. But both of them we do need in our data analysis. Now, in public health, you will ask me, okay, in general, let me give you some example in our life surrounding. I will give you some example in order to differentiate between artificial intelligence and machine learning. A vital example of artificial intelligence that we do have away from healthcare, I will give you healthcare later. Siri, Alexa, Tesla self-driving cars, Google Assistant, all this, it's AI applications. Some examples of machine learning, for instance, we have like Google search, we have tutor analysis, we have sentiment analysis, online video streaming applications. Those are the general examples of AI and machine learning. But what about AI in public health. AI in public health or artificial intelligence in public health. First of all, let's see what it can do for public health. It can, as I said, as conclusion, it can make forecasting of the diseases, prediction of the risk, and diagnosis of health. It has this spatial modeling. What does spatial modeling mean? Spatial modeling means it's related to observing the trends and the patterns of incidence and prevalence of some diseases, outbreaks in particular geographical area for particular population. What can do for us also the surveillance and the pandemic epidemic modeling. Now, in healthcare, how can artificial intelligence support? We have artificial intelligence in diagnosis, in the error reduction for, or the medical error in medication for the dosage. We have in the cancer research, we have in the drug developments, virtual assistance for the nurse, fraud detection, cybersecurity, and gene editing, and of course, robotic surgery. Now, let me put it on more clinical care. How AI can support in the clinical care now. So we saw it from the public health, from the healthcare, and then from clinical care. We have the medical diagnosis, we have the robotic assistance, we have the training, we have stroke management, we have artificial neurons, we have plastic surgeries, and all this will support also, even though the clinical trials, the cardiac tissue chips, the drug discovery, the organ transplants, and the spinal cord injuries. Now, is there a difference between AI and precision medicine? Yes. In a precision medicine, in here, as I said, we have personalized care. We provide the patients with the intervention that he needed when he needed. But artificial intelligence, we will support in early detection, earlier. Now, where in the precision medicine, we have a clinical decision support. In artificial intelligence, it will have more tracking on the progression. So here we will have fairness and bias. Here we will have more liability and transparency, and will have more safety and security, and of course data deluge in which we have huge data that is processed, analyzed in order to inform the decision of, even though at the individual level. So let's make it now in brief how we categorize AI applications in healthcare at the patient care level, at the medical imaging and diagnosis level, at the physician level, and research and development. So in the patient care, as we said, the automated, the assisted diagnosis treatments, the pregnancy management, health assistants, and personal trainers, and the medical imaging, as we said, the diagnostic results, predictive and early diagnostic, radiology assistant, and diagnosis via medical imaging. Now, how it's assist physicians? Of course, we have robotic surgeries, we have personalized medication care, we have clinical trials. All this will support the physician. We have alternative diagnosis, and we have prescription auditing. And of course, in research and development. When I say research, it means I need data. So the data mining, the data analysis, the pandemic detection, the vaccine developments, all we do need AI. That's why now the vaccines are developed faster. The medications are developed faster, because before it takes long time to be. Now with artificial intelligence, it make it easier. Now in public health, now let me move now to from the individualized medicine to public health. In public health, when I say public health, it's related to health promotion. When I say health promotion, it's related to determinants of health and all the surroundings that support people's health. So water treatments, it's a part of supporting people's health surroundings, screening, epidemic prediction, disease surveillance, all this. So in healthcare, what can artificial intelligence do? First of all, it has cost impacts that it can reduce need for customer care. Okay, why? Because we have the machines, we have the AI that can do their task in customer care. We have reduced cost of population health management because it can be faster, more accurate. It can reduce medical loss of as well, and it has also business impacts because it will provide you with the solutions that make it faster and more effective, of course, and it can make it increase in healthcare savings and make it more enhance the engagement of the patients and his experience. And finally, for the operational impact, it will help in accuracy, it will help you in the personalized patient care, it will help you in automated process, in pricing, in sales, etc. It can also collate and analyze healthcare data in silos separately, and it will be efficient and effectiveness as well. So, okay, what about the challenges we told us about? Can artificial intelligence and technology support in addressing public health challenges? Yes, they can. Because with telehealth, with health information system, and with the information of technology devices that have this connectivity and this self analysis, processing of data, and give you the results, this will make it easier for you to mitigate all these challenges. And we have different, let's say, the healthcare devices for IoT, the information of technology. We have in-hospital devices, we have inhalers, we have bed sensors, and those devices actually have these sensors that will support in, as I said, in processors. They have storage capabilities. They can analyze for you the data, and they can also support you remotely. So we can categorize them under these categories: in-hospital devices, wearable devices, implantable devices, and at-home medical devices. And see how this will connect, how this will make the data process faster, accurate, easily to monitor, to track. So actually, it's really promising. And even though in the environmental monitoring, this is another aspect in the remote monitoring system and in the emergency response system, like the emergency alert wearable, in remote monitoring system like telemetry systems, mobile apps, remote patient monitoring kits, and so on. So we want to slot now the digital health solutions under mobile health. This is the technologies, mobile health apps, and mHealth, all these apps that are used thoroughly for healthcare. Artificial intelligence, AI, with all the data in the diagnosis, in the treatments, in the recommendations, in the predictions, and blockchain, how this data is flowed under different blocks in the network. Okay, and this is what we call the blockchain and Internet of Things. So the IoT, or Internet of Things, will be represented by the telemedicine, the traceability of the drugs and supply chain, the streamlined healthcare process, the clinical trials and medical records, and also all the patients' managements and the data consents that provided by ethical consideration related to the privacy protection, regulation, and compliance, and equitable access for those who need it. Now, at the end of the day, the future of public health dimensions in the digital wise should follow this kind of dimensions. First of all, partnership, ecosystem partnership. The funding and incentives and generating of the funds on the resources in order to promote and prevent people's health, sharing the data in secured manner, And we have resilience, we have multidisciplinary approach in the workforce, and health equity. The firms provide everyone with what he needs while he needs it. Now, in the future of public health administration, precision public health, virtual health communities, and genomic medicine, in which we are the future now, we having the customization. So genomic medicine, it's how prescribes the treatments that will be in line with the genes, and this is the future, the genetic medicine or genomic medicine. So the personalized treatments based on the genetics inside. Now, if you want to plan to be a public health administrator, here are where you can slot in. Let me start with, if you want to be in the realistic, so practical, scientific, methodological, so you can be in a different, public health has different and wide scope of tasks and positions and jobs. So public health veterinarians, public health dentists, if you want to be in social health educator, health promotion specialist, if you want to be in investigation, epidemiologist, environmental health specialist, health services researcher, if you want to be in the enterprising, influence and persuade and perform, you can be as policymaker, so public health policymaker and public health planner, other artists, artistics, innovation, intuitive, and creative. You can be in public health communication or as public health communication specialist. And finally, as conventional, you can work as biostatistics and data administrators. And these are some examples of where can public health administrators be and work in public health. And thank you so much for your listening to my presentation.
Thank you, Doctor. Thank you for the wonderful and insightful session. And I'm sure this was a very extensive session where we got a lot of takeaways. You can rest for a while. By the time I will take some questions, and also I'll answer some questions, and then we'll have a elaborate Q&A session. So dear attendees, as you had been asking questions, there are two major questions that were put up in the chat box. The first one being, will there be certificate for this webinar? So let me tell you, yes, there is a paid certificate at $10, which the link for which is available in your registered email ID after the webinar ends. And the second question was, is there a recording? Yes, the recording is available on our YouTube page, which is UniAthena's YouTube page. Okay, so going ahead, just to brief you up on UniAthena and what do we do. So as you can see on the screen, we are UniAthena, making education flexible, affordable, and accessible for everyone. We are a part of the Westward Education Group. So as the screen says, UniAthena is an edtech organization offering online free learning, upskilling courses, and affordable academic degree programs in a flexible manner. Founded in 2019, we are completing 5 years. In 2024, UniAthena is owned by the Westward Ventures, generally known as the Westward Education Group. Westward Education Group is a leading provider of accredited international education and corporate training. So we have more than 13,000 plus students offering. We are offering more than 100 plus courses from 116 plus nationalities and 15,000 plus alumni. So our partners and accreditations come from these universities: Abertay University, Unimarconi, UCAM, Verne American University, CMI, SQA, and CIQ, Cambridge International Qualifications. So what do we do? We basically are making education affordable and accessible by offering free to learn upskilling courses, affordable higher education, with online self-paced undergraduate, postgraduate diploma, degree, and doctorate programs. What makes us different? Learning made flexible, online delivery, self-paced learning, bite-sized delivery, and our unique feature, which is the pay-as-you-go option. The disciplines that we offer courses from come from the marketing, finance, data science, engineering, human resource, blockchain, artificial intelligence, supply chain, and all the disciplines that are there on the screen, and many more.
Yes. So, yes, I can see the questions. I will just answer them one by one. Here we have,
Yeah, ma'am.
yes.
I'll be
Shall I
just
start?
finishing. I'll be just finishing. Give me a
Yeah,
moment.
okay.
So our popular offerings come from basically are from Global MBA, MBA Fast Track, Master in Supply Chain, MBA in Business Intelligence and Data Analytics. So these are our popular offerings. So these are some testimonials from our beloved students. You can see them on the screen: flexibility, effectiveness, support. And lastly, we have a newly released course in Total Quality Management, which is TQM. You can check our course offerings on www.uniathena.com. Okay, ma'am. So we have some of the Q&As. Would you like to start?
Yeah. I have actually two many questions. I will respond to them. The first one, how can digital health technologies be leveraged to monitor and mitigate the impact of genetically modified crops on soil health and food quality, ensuring sustainable farming practices and safe consumption? Farmers always complain about the taste of food and less nutritional contents compared to a more natural and indigenous way of farming. See, I talk about social determinants of health and I talk about food. And I mentioned the technology, I mentioned the agriculture, the technology in agriculture and the digital agriculture, let's say. And I said that now we have many technologies in order, even though to not only to make the foods like more productivity, to have more food, but also to look at the quality. So if you know the foods and what is the agriculture technology, technology, the quality of food, what are the nutrients, and how you can provide the best maybe production of the food. I think technologies, of course, will help you to examine, to make this hygiene for the foods, for the best production or products or items. So actually, this is right what you said, that the food now have less nutritional contents, but this is not because of the way they are being planted or in the agriculture itself. It's the way they are stored. So the technology should support in the way that the food is stored, because once we store the foods for a long time in the fridge, in the storage, so whatever, this will make them lose this nutritionist or nutritional contents. So that's why technologies, it's very important for tracking, for being informed, for having alerts for anything, maybe it's outdated or it's stored for a long time. So we cannot ignore the technology, how technology will support in agriculture, in which is the main determinants of health as one of social determinants of health. So digital agriculture and technologies will support a lot in it. Now, this is very nice, actually, question from Yannick Eba. He said, or she said, I see that public health management with this new approach is digitizing or digitalization of healthcare. And what's the role for healthcare workers then? See, always we ask, can machine replace people in healthcare? Even let's go to the healthcare facility itself. Can machine replace doctors and nurses, and we will have robots in the hospital? Of course not. We still have the ethical aspects. We still have the man innovation aspect. That's why we need to work on the innovation and the strategies and what the machines will give you. What's wrong? What's right? It will give you data, but who will decide? Who will inform the decisions? You are the decision maker, not the machine, because there are so missing aspects, human touches that it's not involved with the machine. I would say that, and to be frank, yes, machine can replace the repetitive actions, but we don't want our energy. That's why I put for you the slides that where our time is spent. I don't want the administrators or the managers to spend their time in the administrative work that can be done by the machine. No, let's allocate more time for innovations, strategies, solving problems than this repetitive action that the machine. So we cannot replace Yani. We cannot. Considering the recent advancements made by the EU in shaping regulations for artificial intelligence, how might these developments impact the landscape of public health? As we said, as I understood from your question, regulation. Everything should be regulated in terms of the data security and how we preserve data or save data. So how this will affect the development or the public health? No, we don't want the regulations. I don't. I think you mean that they will make less usage of artificial intelligence. If you mean like that, we need to rationally use artificial intelligence in a way that it will support. It will not. It will support, and usually artificial intelligence it will support, but without neglecting the the human touches. The machines cannot replace a human. We should put this into consideration. So when you said regulation of using artificial intelligence, because some people they feel that or they think that artificial intelligence can replace and can decide for us. No, it can inform you, and for you it will be from your side, and you are the one who will decide the right decision. How you correlate antimicrobial stewardship with the One Health or digital public health? Yes, it's very nice. As part of digital health and digital health use and artificial intelligence use and the data analytics, they can analyze how people have this antimicrobial resistance and what are the patterns for that and how we can mitigate in order to spot the light that we have a problem in here and we have to mitigate. How to mitigate this antimicrobial, because otherwise we will, and this was really a real threat for public health, and World Health Organization spot on this. So AI, digital public health will spot the lights on these trends of this resistance in order to see the mitigation strategies. Given such developments in healthcare technology, how can the digital divide concern be dealt with appropriately in areas in countries where the technology infrastructure is lacking? See, when I talk about appropriateness, it's appropriateness. Yes, for the one who asked, it's related to provide people with what they need, to provide the intervention that is relevant, to provide the intervention that is consistent with the ethical standards, with the cultural standards, with the preferences standards. So this is the role of public health administrators, actually, to see what is appropriate. And as I said, each community, each population has their uniqueness in the interventions that the public health administrators in this community should take into consideration. How can social media data be utilized for public health research and intervention? Excellent question, Jose. Actually, I talk about Twitter analysis, Twitter preferences, Twitter. By the way, the social media data, all this data are stores and are utilized or analyzed in order to inform the patterns and the preferences of people. I have heard about one let's say, apps related and generated from the social media preferences, how people, for instance, related to the preferred food, how the food, the patterns of people that they are often eating this kind of food. So this time, if they go to the restaurants, and this will be applied in some restaurants, that they will know if you are often going to this restaurant, what kind of food you have to eat. So social media is a big source of data actually for people's pattern of behaviors. What might be the challenge or limitation of AI in disease monitoring and diagnosis? I talk about challenges and limitation. Challenges and limitation. I talk about first of all, the resources. You have enough resources in order to have this aggregation and feeding up of the machines with the data that is required, and also you have to train people to rationally utilize the AI, and this might be also another um, obstacles. I hope that I could answer your questions. Okay.
Thank you, ma'am. Thank you for the wonderful session. So thank you everyone for joining in today. Do keep in touch with us, check our offerings, and do let us know the topics and the webinars that you want to, have. We'll always be there and take care of your suggestions. Thank you and have a very good week ahead.
Thanks
Bye-bye.
for all. Thank you. Thank you so much,
Thank you,
Anikta,
ma'am. Bye-bye.
for moderating, and see you soon. Thank you so much.
See you soon. Bye-bye. Take care.